Good morning. So it's another video from Jeremiah International Academy, and once again I'm Varghese Thomas, principal of Jeremiah International Academy. And so Carol, good morning. Neetu, good morning. Sandra, good morning. Anshu, good morning. Yeah. So this live session we plan to conduct today because there are many concerns from students since they are going for their examination on this Saturday. So with the request, we are trying to clear some of their concerns and basic doubts regarding OET writing, and those who are appearing for their examination on this Saturday or any other date. So I hope this sessions will be helpful for them to tackle their writing subtests while during their OET examination. In this session, we particularly discussing a writing task which was on recent examination and how they have to approach to this writing and what they have to do if they are getting such kind of a questions, and this all kind of aspects will be cleared on this video. And I request, if there is any concerns, you may please text me either after the sessions or in between. If you feel something which is very important that you need to clear it, definitely you may ask in between. Otherwise, we'll have final sessions to clarify all your doubts based on the sessions or any of your concerns. Done? Alright. So, Agnes, Abhinav, Jinsi, good morning. Good morning, everyone. I think this would be a nice morning for everyone, and particularly those who are preparing for their examination. And anyway, today we will move on the further session. So before getting into the writing task, I would like to do some basics of your session. That is, what are the criteria, how you need to prepare this criteria. This will be explained. All right. So for which we'll move on the criteria. Since you know that there are 6 evaluation criteria, and based on the 6 evaluation criteria, at least 5 criteria you should implement on your letter, then only you would be able to clear or get with B grade. So many students will talk like after their examination, I have done very well on my writing, but still my score is 300 or below 300. Basically, even if you are writing with all 5 criteria at least on your letter writing questions or the answer sheet, definitely you would get B grade on your examination. So I know that you all knows about what are the criteria, but still we'll just randomly get into this criteria, since it is a first criteria, that is purpose. That is, some students, at least they believe they have to write either referral or transfer to understand what kind of letter they are doing. Alright. So what OET recommends, it is not enough to just include referral or transfer at the beginning as a purpose of the letter, because this does not tell the reader what is expected from him or her with regard to the patient you are referring or transferring. Alright. So most of common introduction that we can see in every letter, that is, I'm writing to refer or I'm writing to transfer. So many students, at least these kind of misconception is there, like if you're including referral or transfer letter, your purpose has come up. No, never. So on your introduction, what your evaluators or your examiners evaluating or expecting is that you should include the complete name of the patient on the introduction. It is totally based on your local context. And secondly, when it comes the main medical issues and the purpose of the letter. So this much information you should include on your letter. Then only you would be able to crack your B grade or your purpose, the maximum score for your purpose, that is 0 to 3 marks. This is the scoring scale that will be evaluated your purpose. Since we all required 3 marks, and that is a maximum marks for your purpose criteria. And if you want 3 marks, what do you have to do it? That's what we are trying to explain in this video. And the 4 sessions what I have already explained is that it is not just enough that if you are including referral or transfer at the beginning of the letter. That means it is not only enough that your referral and transfer give you exact purpose, not to the reader exact purpose, never. Alright, so what exactly you need to do that? You should clearly mention the patient's complete name as per your local context. Secondly, the main medical issues, that is why you are referring this patient to the reader. That's what is a main medical issue. Might be patient will have several diagnoses or the disease condition, but you should understand for what reason you are referring this patient to the reader. That's what is a main medical issues. And finally, the purpose of the letter, why you are writing the letter. Alright, so there are certain points which could really help you to score maximum, for which you need to read the case note to get a sense of why you need to refer or transfer the patient to the reader. That means, as you all know that either from the writing task or from the case note, you will get a clear picture about why you wanted to refer this patient to the reader. Alright, most of the case note will give you the purpose from the writing task. In either some other time, you may get your purpose from the paragraph of or the case note, that you can get a clear idea about it. So what do you have to do that? Read the case note to get a sense of why you need to refer or transfer the patient to the reader. So this is very important. So as you know that there are 5 minutes time to read and understand your case note before you write. So here, it is not the meaning of that you need to rationally read it or fast reading. No. It is typically what you need to do that clearly understand each of the points of the case note, why you wanted to refer this patient to the reader. Secondly, indicate the purpose of writing at the beginning of your letter. So what is the importance of writing purpose at the beginning of the letter? So since we know that healthcare workers, because most of the letter we are writing to the healthcare workers, in which no healthcare workers will have the time to spare to read your whole letter to understand why he requires to evaluate your letter or why he has to come to this letter or the scenario. So that is the reason, because you should indicate the purpose of writing at the beginning of your letter itself. Alright, so just imagine you are a nurse at an ICU department and any of the patient is transferring from the emergency to your department, and you came to know that the patient has collapsed once after reaching at your facility. So definitely you will have some lagging or some interruptions to provide a proper treatment or proper care to the patient. So unless if you are not knowing the patient is collapsed before he reaches, so definitely they will have interruptions. Alright, to avoid these kind of interruptions on your letter writing, that is the reason, because your purpose of the letter should include at the beginning of your letter itself. That means on your introduction itself, you should include your purpose of the letter. So these are the tips you could understand to to get your maximum score on your purpose criteria. So we'll just go for what are the questions you need to keep up when you are preparing this purpose. So when you are preparing the purpose of the letter, you should focus on the 3 questions, that is, who is the patient, what is the purpose of writing the letter, or why does a patient need this referral. So these three questions are very important, and you should keep always when you are preparing the purpose of the letter. We'll just repeat: who is a patient, and what is the purpose of the letter, and why does the patient need this referral. So these are the three questions you need to ask your question, then you can understand what exactly the purpose is, because many students are facing problem with identifying purpose from the question paper. So just please note it down. So if you feel three questions definitely to help you to pick the correct purpose from your question paper. That is, who is a patient, and what is the purpose of writing the letter, and why does the patient need this referral. So these three questions you need to focus on it. And further, when it's come, because I have already provided a writing question which is Mrs. Celia Clement, and we just answer for all the three questions from that particular question paper. So definitely you would be able to understand, and I hope most of you have already prepared this question, and would definitely these kind of answering to each of the question, you would be able to understand exactly how you need to pick all this information to this answer sheet. All right. So what is the name of the patient? That is Mrs. Celia Clement. And why that is the purpose of the letter is care and management. From the writing task, you could understand what is the purpose of the letter, that is care and management. And why this care and management? Because we don't understand until unless if you come to the case note. So what kind of care and management you need to provide? And from the case note, you came to know that patient underwent a surgery, correct? Underwent surgery for cholecystectomy, and the post-operative care you would need to provide to this patient, right? So why she need referral? So this is what something is very important. This can merge with your purpose. So definitely your introduction part will be clear. That is, she needs referral because the medication comply that needs to be monitored, and wound care, obviously since she underwent a surgery, so surgical wound care is very important, along with a diet modification. So these are the important aspects which is required. That is the reason that you are made a referral for Mrs. Celia Clement. Is that clear? Alright, now we'll move on further. So when it comes to the second criterion, that is the content. Alright, so this is a very important, that from the second criterion we need to understand. So the marking strategies, that the marking scale will be mentioned from 0 to 7. So if you are giving maximum effort on each of the criteria, then you will get the maximum mark and you can score better, that is upon A grade. Alright, and this criterion assesses your ability to include all the key information and communicate it accurately. So this is very important. So why you need to consider this content criteria? Because this criteria assesses your ability to include all the key information and communicate it accurately. So this is very important. So why or what we have to do it? So in which, what are the information which you feel it is quite relevant to the reader? And since you write the letter and you are the writer, and the person who is evaluating or the person who receive your letter, they are the reader. So whenever you consider the key information or what are the information is required to communicate with your reader, so you should understand on the viewpoint of your reader to look at each of the points in your question, that is case note. So you would understand what are the information are the key, or what are the information are relevant, that you can understand. So to do this, think carefully about the audience, that is your reader, and their role in the patient's continued care. So even though if it is for the continued care, and you can understand if the letter to a dietitian or if the letter to a physiotherapist, so what their role, what is the role of reader on to this patient care, that is something is a key information that you can include on your letter writing. And to get a good scores or a better score on your writing with the second criterion, that is content, you should have a good awareness of the reader of the letter. So what you have to do that, you should understand what exactly the reader is. So if you can understand that, definitely you would be able to gather the information which he requires. Alright, then consider whether your reader is aware of the patient case and what is necessary for them to know for continued care on this case. So whether you should understand what type of letter you are writing. So whether it is a non-case letter or it's an unknown case. So if it's a non-case letter, you should describe what are the information would be required to the reader to provide this care. Alright, so be accurate, that is a third one, be accurate. So why it should be accurate? Because when it's be convey the information present in the case notes without changing the meaning in any way. So what you have to do that? So you should, without changing the meaning, that you need to present it on the case note. So sometimes the people are struggling to provide appropriate care or appropriate meaning of the sentence or the information which is given in the case note. So what do you have to do that? You should understand what exactly it is required on your question paper that you need to convey in a proper way that to your answer sheet. And you may paraphrase or summarize as long as this does not affect accuracy of the meaning. So you can paraphrase or summarize, doesn't matter, but it should not affect its accurate meaning of the information what you are trying to give. Alright, so I'm just running with, because I wanted to explain a case notes too. So in between, if you have any doubts, please ask me, so we can clear it off and then we'll move on to the third criterion, that is conciseness and clarity. And this criterion assesses your ability to convey information effectively and recognize irrelevant information. So most of the practice, the people are trying to look at the relevant information. So until unless if you are not able to find out what are the relevant information on your case note, then it is going to be a trouble that you could not find exactly what are the information would be relevant. Alright, so you should have keep on an eye on what are the information would be relevant, then only you could find what are the information are relevant, or you could stress more on the importance on why that particular information are so relevant. So these are the points which you need to keep up every time to understand what are the relevant or what are the information which your reader require. Is that clear? And this case notes or this OET writing sub does not contain a lot of information, because your since you know that, so what are the information which you are taking up for your information or the letter. So the case note which not contain much of, or sometimes there will be a lot of information which you weren't able to manage it properly. So what do you have to understand ultimately from that? Not all the information are relevant to your reader. So what do you have to find out? Because we already discussed about the content part. That means not every information are relevant. So here what we are trying to say that the irrelevant information which you need to make it excluded from your writing, and the relevant information that should explain in effectively, that is the things which will be assessed on your third criteria, that is conciseness and clarity. What are the information with the relevance, even if you are getting into your letter, that you should mention clearly. What you have to do this for to get a good score, in which leave out all irrelevant information, and secondly convey your information your reader needs to know in the most efficient way possible. So sometimes the people, the student, the candidates, those who are appearing their examination or their practice, so what will happen, like the most efficient way, that means the sentence structure itself, it is putting into the trouble. So they weren't able to most efficient way, that even if you are trying to say that he is diabetic and he is on medication since 2000, all right, so in which you would have been used Mr. John has been on metformin 500 milligram for diabetes since 2000. Alright, so understanding its proper structure, you could concise the information, and this will help you to identify what is the most efficient way which is possible to the reader, and also summarize the information from the case note when necessary. So whenever, not every information, or particularly like a diagnosis, you can't make it in another form of writing to your answer sheet, the same way that you have to pick it out from your question paper to the answer sheet, but you can summarize the information wherever or when it is necessary, that you have to focus on it and avoid explaining key information in a complicated manner. Some people believe that you should write only a simple form of letter writing. Some people believe that you should use a simplified form of letter writing. Alright? But ultimately, when they are transforming their answers to the answer sheet, what will happen? It will become a complicated manner. Alright? So to avoid these kind of things, what you have to do that, avoid explaining key information that which you feel or which you believe the information which is very important to the reader, and please explain it in a proper manner, not into a complicated manner. Alright? When it comes to the fourth criteria, that is genre and style, and the written documents in the healthcare setting are formal, professional and factual. So it's very important that you should understand what are the information as given on your written document, that is in your writing. So when it comes like formal, so what do you mean by formal? Your tone of the letter should be formal. Since you are writing to the healthcare professionals, you can't include any informal aspect to your letter writing. That is the reason, because you should keep up in a formal tone of your letter. Now, what do you mean by factual? So factual means you avoid adding your own judgments and feelings about the case. That means your personal opinion or the judgments you should avoid from your writing task. This is very, very important. Alright? And finally, use medical terms appropriately, always considering how familiar your reader would be with a particular term. So this is what your professionalism will be evaluated on your letter writing. That means you can use medical terms. So some people believe that you should not use any abbreviations. Sorry, definitely you can use it on, but there are some terms and conditions, which is if your reader is on your discipline, or the discipline which he can understand all the terminology which you have included, then he can use the abbreviations. Alright? And some other people are at least misunderstood that at the end of the question paper it's given should not or do not use note forms. Is this note form is similar to the abbreviations? No. So abbreviations are not a note forms. Alright? An incomplete form of sentence is called note form, and abbreviation is something like a not expanded one, which is given on your, for example, MRI. Alright, so the expanded form is magnetic resonance imaging. So you should understand whether your reader is familiar with MRI or magnetic resonance imaging. Then definitely you should give the information accordingly. And since I mentioned that you can use abbreviations, but you should understand a globally accepted abbreviations only you should use on your letter. You can't use any of your personal abbreviations onto your letter. Alright, so this will give you this will help you to get the maximum scores on this criteria. Now when it comes to the organization and layout, which is the fifth aspect, and organization helps the reader to get the communication in a clear and easy way, or he can read it and understand very well with your writing. And you need to organize your letter in a way that helps the reader to find the important information as quickly as possible. I just give an example for which, when it comes, it's very important, that is, you should use a chronological order when you are providing the information. So what do you mean by a chronological order? That is presenting the events in the order in which they happen. That means So not every letter you can't make a chronological order. So what do you have to do that? You should use the information, or you should present the information in the order which they happened. Alright. Secondly, when it started and ends with today's findings, latest development followed by the call to action. So this is what something which you have to focus on, the chronological order. That is, I'll just come again. He should be presenting the event in the order in which they happen. Either the first visit, second visit, and the third visit, and today's matter. Alright. So this is the way that you can use it. So when you prefer this chronological order, you should understand whether it is actually required on your letter. Based on that, you should use this chronological order. Secondly, when it comes to the problem and solutions, alright. For example, on the first visit, the patient came with headache, alright, and you have given the management. Second visit, he came with some other problem and you have given the management. Third visit, he came and you have given some solutions for it. So this is a way that you can include the information. Alright, that means each paragraph deals with a distinct idea or point, and each paragraph begins with here what the patient needs and ends with thus as what it needs to be done. So these are the way that you can provide the information on this organization. And finally, a hierarchical way of presenting. That means you present the facts or the information in order of decreasing importance. In the other words, the most important information you should include in the first body paragraph, and least important information or less importance followed by that you need to include on your paragraph. Alright, is that clear? So I'll just come again. A chronological order or a problem solution based or hierarchical methods which you can use for a proper organization on your letter writing. Is that clear? Well, when it comes to the last criteria, since you all knows about, so the linguistic aspect, something which is focusing on this workplace communication, that is your written order on your writing part. So why it is very important? Because your sentence structure that you need to focus, whether it's a compound or the complex sentence which you have to include on your letter writing, or else it should be simple sentence, or what are the status of either in the active voice or in the passive voice. What you have to do that structure of the sentence you should focus in every time, and avoid common spelling errors. Maintain spelling convention either in US format or in the British format. But what you should have to focus throughout your letter, any of the convention which you are following, the same thing you need to focus on it. Alright, and punctuate your sentence clearly. Since you know what are the punctuation which is required on your letter, that punctuations you should use appropriately. Use the last 5 minutes to check your work and correct any errors you notice. So this is very important when you are managing your time. So first 5 minutes you are taking to read your whole questions, that is case note and the writing task, what you have or what you supposed to do it, and then 40 minutes you are taking for write your letter, in which you should give some times to proofread your letter, and you can correct any of the errors which you notice. And if you consider as your letter when you proofread, then definitely it is difficult to find any of the mistakes. So what do you have to do then? Consider this as someone others, your others letter. Alright, then only you could find exactly what are the spelling or is there any mistakes which you got in your letter. Alright, so these are the criteria which would be focused on when you are writing a letter. So this is very important when you're preparing letter. Now we will focus on based on the question what we given yesterday, and that is something is a major session will be discussed in this class. So since you know that there are some basic format of writing letter, that is either because here I am given the address part first and date as on second. So most of the students will keep only the format of date on the first part and the address in the second part. So I should tell you that OET recommends if you are focusing the address part in the first or the date part in the second, both are perfectly correct. Alright, so OET recommends based on your local context how you are following, you can do that. So this part, if you are writing address in the first and the date in the second, so you will not lose your marks. Definitely you will get as part based on your evaluating only from the paragraph wise how you are organized, all the criteria has been implemented or not, or this part only based on your marks will be done. Alright. And from the case note, we can know that you are writing to Mr. Malcolm Hamilton, and he is the general manager of Holland Cross Care and Tower, Puttingham. And the date is 8 January 2022. Actually, on your question paper, it's given, assume today's date is 8 January 2022. So what you have to consider, today's date is 8 January 2022. So you can use 808/01/2022 in any manner. It doesn't matter. This structure of your date will not affect your marks. And we will greet the recipient, that is dear Mr. Hamilton. If you are putting comma after dear Mr. Hamilton, is also fine. If you are not putting comma, then it's also fine, no issues. So I haven't used this comma because I just wanted to show you that how your letter can be. Alright. So the other way that you can include the letter. So reference Miss Celia Clement and the age 78. Alright. So you can use age or aged 78. When you are using age, then you have to use is 78 years or 78-year-old. Any manner would be fine. I made an introduction, like you can even please check with your writing what you have made up. And Mrs. Celia Clement, a resident at your facility, because since it is a known case and for the last 4 years this Celia Clement is a resident at the same facility, that's the reason, because instead of writing a known case or I'm writing to update the current health status, instead of we could make the sentence like Mrs. Celia Clement, a resident at your facility, she is recuperating from a laparoscopic cholecystectomy, requires further care and management. So here I haven't mentioned like refer or transfer, because I just want to give a sentence such if you are avoiding refer or transfer, how the introduction will be. So this is the reason, because I just given an introduction similar like Mrs. Celia Clement, a resident at your facility, she is recuperating from a laparoscopic cholecystectomy, requires further care and management. So from which, so we have discussed about the patient's complete name. Even if you are writing Mrs. Clement, that's also perfectly fine, but more on based on our context you can use Mrs. Celia Clement. So if you are using only Mrs. Clement, don't worry, you will not lose your marks. Alright, so Mrs. Celia Clement, a resident at your facility. So the reader can understand, alright, she is a resident at this facility or my facility, and she is recuperating from a laparoscopic cholecystectomy. And from the case note, we can understand the patient is totally recovering from the current situation of after from the surgery. So requires further care and management. Alright. And if there is any doubts, please feel free to ask. So we will answer for the questions. And if there is any concern, even you may ask at the end of the sessions too. So we will answer for all your concerns, and we will help you to do that. And when it comes to the further paragraph, we already mentioned that either your organization should be a chronological order or problem and solution based or hierarchical. So this either any of this you should include on your letter, so you can understand how or what's the manner that you are writing your letter, and you can understand we can provide in a proper way. Alright. And when it's fine. Okay. So when it comes to the second paragraph, that is the first body paragraph, Mrs. Clement was admitted to emergency department with abdominal pain. As you know that there are several complaints that is given, and we are just taking with Yeah, Mrs. Clement was admitted to emergency department with abdominal pain along with sweating, nausea and vomiting. So if you are looking for a good scores or better scores on your examination, so what was a major complaint that you need to highlight it? Alright, so the emergency department, why the patient came with the abdominal pain, along with what was a complaint for him, for her, that is sweating, nausea and vomiting. So these was a problem why the patient came to your facility. And when it comes further, a diagnosis of acute cholecystitis was made and surgical intervention was advised. Alright, so a diagnosis of, you can use instead of she has been diagnosed with or she was diagnosed with acute cholecystitis, you can make a sentence with a diagnosis of acute cholecystitis was made and a surgical intervention was advised. Alright, so this is the way that you can use your sentence. And we came to know that from the question, because of the some kind of an infection, she has been initiated on antibiotics and paracetamol, and she was sent home. After that, she readmitted for the surgery. All right, after resolving with the infection. So we can think about how to make a sentence. In view of infection, she has been commenced on antibiotics and paracetamol. She was discharged on 26 November 2021 with the advice of continuing medication for what purpose? To resolve the infection. So these are the way that you can include the first body paragraph. So I'll just read it again for your perfect understanding. That is, Mrs. Clement was admitted to emergency department with abdominal pain along with sweating, nausea and vomiting. Right? Second sentence, a diagnosis of acute cholecystitis was made and surgical intervention was advised. In view of infection, she has been commenced on antibiotics and paracetamol. She was discharged on 26 November 2021 with the advice to continue medication to resolve the infection. So these are the way that we can write your first body paragraph, because that seems so important. And either you could have been do that it is a chronological order which has happened in the first that I have mentioned in the first paragraph. Now when it comes the second para, that is second body paragraph, on 6th of January 2022 she was readmitted for the surgery. So why the admission? Because of she wanted to undergo for the surgery, and that's the reason, because she got readmitted. And since there are no signs of infection, why she got admitted, what was the plan? So we can understand, because there are some kind of infection, that's the reason, because her surgery made up or postponed or rescheduled on 6th of January 2022. Alright. And why the surgery has been scheduled again? Because there are no signs of infection. And her post-operative period was unremarkable. And paracetamol 1 gram continued as long as required, because until the patient's pain is resolved, we can continue the paracetamol 1 gram that is mentioned in the question. And further, additionally, so when it's to add on the points, that is, the surgical wound were observed for any signs of infection and prescribed antibiotics and IV fluids along with the paracetamol, antibiotics and IV fluids commenced post-operatively. So this is the way that you can include the second body paragraph. So it is coming by event, so that gives you a proper organization for your reader. So on 6th of January 2022 she was readmitted. And another matter which I wanted to discuss based on when we are discussing this paragraph, and it's very important that some students at least they try to follow every of their paragraphs should include with the patient's name. And what exactly which is required on your letter writing is that until unless if you're not mentioning any third person's name on your paragraph, it is not required that you need to repeat your patient's name. Then if you could do that, so that will be an awkward format. So it's not required. You can use some pronouns to mention what the patient does. Alright, so that you can do it. And She was readmitted for the surgery since there are no signs of infection, and her post-operative period was unremarkable, and paracetamol 1 gram continued as long as required. Additionally, the surgical wound were observed for any signs of infection and prescribed antibiotics and IV fluid. And there are a frequently asked question is that, should I use any preposition after prescribed? Actually, it is not required. So many students, they are following a writing of prescribed with. Actually, prescribed with is not required. You can directly use and prescribed antibiotics and IV fluids. That is the perfect use of prescribed. Alright. Now when it comes the third body paragraph, that means today's what is happening. So today she has made symptomatic improvement. It is imperative to monitor her medication adherence. So it has been very important that you can use monitor, comply with medication, or medication compliance, or medication adherence. Any vocabs that you can use or the synonyms would helpful for you to maintain your letter. Adherence and wound once in 2 days, apart from remove dressing after 2 days, or along with any conjunction, or you can use it over here. And in view of flatulence and indigestion, a modified diet plan would be appreciated. It is also worth to refrain from spicy foods, and restricted use of salt, fat and calorie has been advised. So these are the paragraph or body paragraph which we made. So from all these paragraph, what we can identify, even by even or day by day, what has happened, that we made in a chronological order. So that is what something which you would be able to clear when your letter is on the way, that you can write it in a proper way. Alright. And further it comes, should you have any further queries, feel free to contact me and yours sincerely, staff nurse gastroenterology ward, which is given on your question paper. So since you know that where to use sincerely and where to use faithfully, so if the recipient name is given on your question paper, so yours sincerely can be used, and if there is no name and starting with the designation of the letter of the recipient, then you can use yours faithfully. Is that clear? Alright, so this is all about the question and the task explanation, and now it's a time for discussing if there is any concern from your side, or if there is any particular doubts or something which is not clear during this task. So definitely we would have been ready to help you. So if there's any kind of questions, you may ask me now, please. Additionally, I just wanted to give you some more information, since we are just receiving some of the questions, and what I just wanted to say that those people are reading for their examination, writing examination. It's very important that during the first 5 minutes you will be getting time to read your question paper. During this time you will not get a chance to write or scribble anything on your question paper or the answer sheet. Alright, so during this time read carefully. If possible 2 or 3 times you please read it, and then take about 30 minutes to write your letter, and the further 10 minutes it's very important that you could read or proofread your letter and edit if there is any mistakes, and this would definitely help you to find a good scores when your results come. Alright, Anshita, could you please explain the discharge plan? Definitely. So because there are a lot of discharge plan, it is given the medication monitoring and the wound dressing, and remove the dressing after 2 days, and because there are chance of flatulence and indigestion, so modify the diet plan. So this would be most appreciated that you could use it, and also avoid spicy foods, and low salt, fat and calorie has been advised. So instead of, you can make the paragraph like, today she has made symptomatic improvement. That is the reason, because you are making the patient, because since she is fit for discharge, and fine. So you can do that. it is imperative, that means it is important to monitor her medication adherence and wound monitor wound once in 2 days and remove dressing after 2 days. And because of the flatulence, the possibility of flatulence and indigestion, a modified diet plan would be appreciated, and it is also worth to refrain spicy foods and restrict the use of salt, fat and calorie has been advised. Alright, and another question which I have been received, should I use emergency department E should be capital or small letter? Both are fine. If you're using emergency department in a small letter, the lowercase letter is also fine. If you're using uppercase letter, since it is a name of a department, both are fine. So that will not affect your marks. And it is necessary to explain first admission details in non-case. So it's very good questions, since we need to explain why we came to the level of cholecystectomy, or what's made us to diagnose with cholecystectomy. That is the reason, because we have to explain and what are the reason for the admission. We are not very sure whether the patient, when it comes to the hospital or at the care home, whether the patient had nausea and vomiting or only with the abdominal pain. So we are not very sure about. That's the reason, because it's been important that we need to include the admission details over here, but we are not including any of the past medical history, because for the last 4 years the patient lives in this particular care homes. And Shruti, please explain discharge plan. That's we already explained, because there are few discharge plan which is given, that is monitor the medication compliance, and similarly medication compliance, and the wound dressing suggestion is required, and dressing after 2 days, remove the dressing after 2 days, and there are possibility of flatulence and indigestion, and for which the diet should be modified. Alright, so these are the given, and she should be refrained from spicy food and low use of salt, fat and calorie as advised. These are the discharge plan. So all the information, since it is a post-operative case and as back to the care home, all the information which is in the given discharge plan is important. I hope it's clear for you. And Shruti, Leah Sebastian, is it necessary to write information regarding the first admission since it is a non-case? Definitely, because until unless the reader will not be able to understand what symptoms or what information made us to reach on the diagnosis of acute cholecystitis. And that's the reason, because it's been required that we need to mention the information which is given as an admission. And just now also asked the same questions. The answer is same, like you need to inform what was the particular stage of patient when reached to your facility. That is the reason, because we are including that. And actually see, this is a non-case, and so it is necessary to write about the first admission. Actually it is so necessary that you need to write, but if you are using like definitive symptoms of acute cholecystitis, you can make the sentence, then you can avoid all the information such as abdominal pain and so and so, or else you can do that it's possible diagnosis of acute cholecystitis was made in view of her initial symptoms. The way of you can paraphrase the sentence, that is also not a problem. Toji, it's been asked, repeated words like name of the patient in each para and patient diagnosis perfectly, which is not required every time when you are writing this repeated information which is already understood by the recipient. So then it is not required that you need to repeat the information same of there. But it does we need to put a comma before who in purpose paragraph. Obviously it is totally based on the context. If you are writing I'm writing to refer Mr. Peter who requires further care and management. So then obviously, since the context is requiring a pause on the sentence, you need to put the comma. So just what you have to understand. So there are some kind of optional situations are there in which you read the context clearly, and there if you feel kind of a pause, then definitely you need to put the comma, and it doesn't matter or doesn't give any kind of use or rules and regulations that you need to put the comma wherever you write whose. It's perfectly not. So you can do that accordingly if you feel any kind of pauses over there. And then all the medical data relevant to return a general manager. Yes, obviously this is a case manager. We can understand he is going to take care of this patient after post-operatively. So that is the reason, because we need to use a medical aspect, because since he and she underwent a surgery, and further care is totally based on the surgery, and that post-operative care is being managed because you believe that this general manager is the right person to provide the care for this patient after post-operative, since our post-operative period. That's the reason, because you need to include all the information which could really help the reader to provide the care. That is the reason, because we include all the medical information over there. The general manager of the care home means they might be a care provider only. And do we need to put a comma after sincerely, Harita? Actually, it is not recommended that you need to definitely put the comma after your sincerely. So while in the initial format, that is dear Mr. Hamilton, if you are putting comma over there, then after yours sincerely you can put the comma. If you are not putting the comma of yours, like dear Hamilton, then it has been not required that you need to put a comma after yours sincerely. I hope it is clear, Harida. And is it okay to write instead of along with in compliant? Yes, definitely you can do that. In additionally, she also experienced, so definitely you can use that. Is there any chance of on behalf letters? That's it is ask questions, but we can't do that any particularly. We can't expect. I hope I understood that he's asking about, is there any chances for on behalf letter on examination, or do we need to explain any on behalf letter? Then definitely we can do that. We'll discuss an on behalf letter on further sessions, but the examination we are not very sure about that. So definitely we can expect, because so far during the last year it was totally on non cases. So this time might be there are chances to get all the types of questions. So please prepare all the questions, and if there is any concern, definitely you may please contact us. Which of the connectives can be used in OET letter? Basically, the OET recommends that there are certain conjunctions which you should. That means that they are not recommended to use it, because since it is an overused one, so kind of moreover, furthermore, besides, hence, thus, and as, and these are the conjunctions commonly they are trying to recommend to avoid from your letter. That doesn't mean that you should completely avoid, until unless if there is no use at all, or if you feel like you have no other options to use, avoid this kind of conjunction from your letter, then you may use it, but it's not highly recommended since it has been overused. Okay. And can I write purpose like I am writing in regards to Meenu Subin? Basically you may write it please, and in any manner of based of your writing you can use an introduction pattern or the purpose paragraph. But it doesn't matter if you are writing, I am writing, but it is kind of an overused one. If you could paraphrase on with your own sentences, so that will give you more chances to get the marks. So that is the importance of when you are doing this. And if there is any other question, please ask me on this time. If I missed anything, is there any need to write date in letter? If you are not, the questions by Anju, see, if you are not feeling any date is so important on your letter, it's been not required that you need to write the date. So I think it's particularly Anju asked about the admission date or something. So it is not recommended that, because until unless the date is so important, you can avoid the date on your letter writing. Is there any other questions? You may please ask. And if there is any further concern, you may please contact Jermia International Academy, and we are located in Calicut and Mysore as well. And if you feel any, so fine. While writing about treatment, sometimes we write she was initiated with or treated with analgesic or etc. So is it okay? Definitely it is fine. So you can use any of the format, but only you should focus on the letter and the tense of the sentence and the structure of the sentence. Otherwise you can use it a treated with or initiated with, not a problem. Then is there any other questions? You may please ask, so we can give the answer for it. Anyway, I'm just continuing where I've stopped, and we have branches at Calicut and Mysore as well. And if there is any concern for the inquiry regarding your OET examination and your OET sessions, that will be clear. And also we are running with online and offline sessions too. And besides, we should appreciate all the candidates those who clear their examination recently, including for the doctors and nurses. So if there is any queries regarding nurses and doctors OET sessions or the classes including IELTS, we are providing the sessions for it. And since you know that USA also providing the opportunity for the nurses to work with, and you can even do your NCLEX or any traumatic courses from here too. That also will be help you, and even with online and offline sessions too. And if you feel the session was interesting and it is useful for you, please share with your friends. And there is another questions by Achniya, that is, can we begin a para with date? So if you feel that paragraph requires the date is quite important, then you can use begin with the paragraph with the date. Or else if the date is not so important, because I have started because that particular day on 6th of January patient readmitted for the surgery, and the surgery was done on the same day. That's the reason, because I made it the date with. Otherwise, if you feel like there is not the date is not so important, then you can use it in the begin at the end of the sentence or at the middle of the sentence. That is not a problem at all. So Vijesh, continued care, further care and follow-up care, ongoing care. So basically based on the context, the meaning will be changed. If you're using continued care, where it has been you have stopped or what the care you have provided, that should be continued. That's a way of continued care. And ongoing care, further care, it's kind of looking same meaning, that you can use it the further care. What are the care which the patient required, that he need to provide it. So that is the main concern of this. And there is another question from Matthew Thomas: is the German classes is there? Yes, definitely we do have the German classes too. And please contact us on the given number, so we'll give all the information regarding what are the German classes. And further classes will be scheduled as soon as possible, because there are many inquiries regarding the writing and the speaking sessions. Also, some students are facing some difficulties on reading and listening too, and we are providing a detailed discussion on both online and offline for reading and listening discussions part. And if you find difficulties on any of the modules, you may please contact us. We'll give you a 1-month intensive session for your exam batches particularly. And even if you have 1 week for your exam, don't hesitate to call us, so we can definitely help you for this. Now, what are the things which is required for you, that will give you on the sessions. And as we all know that after this pandemic situation, somewhat we are free now for the offline sessions, and we are fully fledged for the offline sessions too. And if there is any requirements for your offline sessions, please contact us, keep in touch with us. And if there is any further queries, on the comment box you will be getting our contact numbers. You may please contact us. And till we meet next time, thank you and bye bye.